You're watching TVC Breakfast. The outbreak of the novel coronavirus challenged the world in ways never before seen. The pandemic ushered in a way of life, and everyone has had to adjust to the new normal, as we call it now. But it has not been all gloom and doom. It resulted in a huge reliance on technology and internet penetration. Necessity, as they say, is the mother of inventions. Students had to learn from home, and almost everything that previously required physical contact had to be done virtually, and healthcare was not left out. So patients now have consultations with their doctors virtually through a video call. This is what is known as telemedicine. Stakeholders are now advocating that telemedicine be encouraged so as to improve medical efficiency across the country. So joining me this morning to discuss this and make sense of it is Kazim Lawal. He is the CEO of telemedicine platform AxoCheck. Kazim, good morning.
Good morning.
And good to see you.
Pleasure is mine.
Great. Now, when we talk about telemedicine, of course, this is not new as far as the term and word is concerned. But for a lot of people who may be hearing it over and over again, but are not necessarily in the cities of Lagos and all of that, they may feel it's something too techy or something too sophisticated or something, can you break it down basically for our understanding? What constitutes telemedicine?
Yeah, so that's a great question and nice to be here, Mike. So telemedicine, no doubt, is an ability to scale medical care by way of using your phone, right? And
our phones?
Yes, you can use your phone,
Great.
Right? By way of using your phone, so you can speak directly, if you will, to a medical practitioner on the other end, and they can help you as opposed to being in their presence to help them.
So how more beneficial is telemedicine when you have to interface with your doctor via video than when you meet physically?
So I think there's an opportunity on both sides, right? There's some times that you just need to speak to a doctor. I think all of us have called a doctor before with the phone and we've spoken to them. Here we're just enhancing that experience where you can actually see them. And if you have a pain somewhere, they can see it, a rash or whatnot. It enhances it. But when you think about Nigeria as a whole, where we have less than 100,000 doctors, and less than one doctor to 5,000 Nigerians, as an example, you would agree with me that we have to find ways to scale medicine, if you will, and the practice of medicine. And I think telemedicine becomes extremely critical to our ability to do so in our great country, Nigeria.
When we talk about this, you need to have a smartphone and then internet and all of that. We know that away from maybe cities like Lagos, Port Harcourt, Abuja, and maybe Kano, a lot of people will have the challenge of, understanding how these things work and then also, keeping up with that. Talk to us how cheap this is or how affordable this is for everyone.
Yeah, so on our platform, not only do we have the ability so you can see someone, you also have the ability to just pick up the phone and call a hotline and you speak to a doctor.
Oh, okay.
To your point, or laddering to your point that not everybody has a smartphone. So we're providing different ways where people can speak to an expert that can help them. And quite frankly, if they need to go see someone in person, that we'll also provide that thinking as well.
Now, for doctors who are involved in waiting to be called and then, offering that service for everyone, how are they taking this?
Oh, no, doctors, the practitioners have been so involved in the process. In fact, I would say that they're leading the charge because, as you know, in the Western world, this has become a process. It's part of what we do in medicine. And Nigeria being a great country as it is, we're all now kind of wrapping our minds around this and slowly but surely going on this crusade and creating a lot of awareness around it. It's an important and integral part of medicine going forward.
But how are doctors also trying to juggle between I have patients to attend to in the wards, and then I have a telemedicine or a video call from maybe an outpatient somewhere. How do they juggle this together?
Scheduling, right? So scheduling on our platform, we have doctors that work for us, and we've created a schedule where they know when they're available for them to be able to take that. So you schedule. We have an app that does all that scheduling work to ensure that they are available to be able to take those calls.
So for you at AxoCheck, talk to us basically how you make telemedicine more beneficial for people and more simplistic for people, especially for those who are not very savvy with some of these things?
That's good point, right? At AxoCheck, we actually deploy a hybrid approach because we know that there's still some opportunity with people truly embracing full telemedicine. So what we do at AxoCheck is that we actually send to your home a registered nurse who is going through the onboarding process with us. We vetted them. We know that they're registered. They have a license to practice nursing. So they go out to the home, and at the time of when they finish that service and they do the check, then they speak directly to a doctor over that telemedicine platform that we were talking about. They get that second layer care, and if the doctor needs to prescribe medication, they prescribe medication. If there's a need for additional conversation, and that client also has a phone line, a hotline where they can call directly to speak to a doctor. So what we're doing is that we're giving them a variety of methods, if you will, to kind of interact with a physician, be it a nurse, be it someone that can help them from a healthcare perspective.
So for the medical practitioners who people will be talking to, do they have to subscribe?
Yes.
There has to be a subscription for either for the hospital or for the medical doctors or nurses for that to happen?
Yeah, so on the practitioner side, so what we've done is that we've brought them on board think about as independent contractors. These are individuals that have their day jobs, right? But they're saying that on these days I have availability to help somebody else, and obviously we're paying them to do that. So they come on our platform, they sign up on our platform, they go through an onboarding process, they provide us timing in terms of when they're available, and we kind of put that into our database to ensure that we are bringing jobs to them that fits their locality and their time availability. Yeah. Now, on the converse of that, people that are patients actually go on our platform, AxoCheck, which is online through iOS, Play Store, or Play Store or Apple Store. You can download it, you sign up, you add yourself as a beneficiary, or maybe you live in Abuja, you want your mom who lives in Ibadan to have the platform, so you add them there. So it's in the system. So we go there, we go into your home, we do the check, then you capture all the information on the platform, and you have access to the records as well. Because as you can imagine, one of the challenges is there's no medical records to the extent that, that we should have it. So not only are we helping them, we're also capturing medical records, taking doctors' notes, and all of those types of things that not only helps them today, but you can imagine helps them tomorrow, right? As a child, my parents, as an example, if you've captured this over time, you should be able to see some trends and saying, okay, hey, I need to stop worrying about this because my mom and dad has the situation, and we start to help them in real time and make sure that we give them long life and also prevent any issues that might come.
Amazing. How is government partnering in this? Or how are you partnering government on this? Because at the end of the day, how healthy the people are.
Yes.
Government is the ultimate beneficiary of that, because if you're talking about the population, how healthy a population is how much they work, and it's how much revenue government gets from taxes and all of that. So there's...
I couldn't agree more, right? So I think where you're going, you're saying, Kazim, the biggest asset this country has is the people.
Of course.
So when you think about it that way, that's why we are so excited and passionate about this. Because if we're truly going to take Nigeria to the next level, the people, that capital, that human capital, has to be in the best shape. Right now, our life expectancy is less than 60 years. Yeah. That is horrible. That is scary. So if we're going to get better to get to where England and the US are, which is 70 and 80 years old, we've got to get our preventive healthcare right before people have problems. So we are in some conversations with some of the government agencies and talking through how we can partner with them, but still things are still in the works at this point.
So let's talk about how to distribute medicine. For instance, I get on the app, and then I call a doctor, and then I speak to the doctor, and then telling him how I feel about whatever I'm feeling, and then he feels this is what is going on, this is what you have, and this is what you need, and all of that, and then drugs are prescribed. How do I get drugs? Or do I just have to use his words to go to a pharmacy and all of that?
So at this point, where we are today in the journey is that you'll take the prescription, if you will, you go to your closest pharmacy. That's what we're doing today. But we're on a journey right now. We're taking one step at a time. What we want to get to is that we want to be able to say, hey, Mr. Kazim, you need amlodipine for your high blood pressure, as an example. With that said, we want to be able to say, in the next 2-3 days, you are going to get this at your doorstep that is going to come to you. And now that we know you're on medication, month over month, we'll be providing that medication to you. Obviously, the client will have to pay. But to your point, it makes the experience much easier. To the extent that you get it, you don't have to worry where it's coming from. Is this original medication? Is it fake medication? So all of those things we will vet as an organization to ensure that they're well. And then we watch, right? Things get better, you get off of it, you might need to increase it. And we also have lifestyle changes as well that we'll also be recommending to the clients because we don't want clients to be on medication for the rest of their lives. There are things that you can do to improve your lifestyle, and it's all about education.
So people get to receive advice in that regard too, right?
Yes.
Okay.
They certainly do.
Oh, great. Now, I am really very concerned about people who are not in the cities. I've asked this question several times. So what are you doing to ensure that you expand beyond the cities, where everyone has access to all of these things?
So that's a really good point. The good thing is that in Nigeria we have a lot of NGOs. I give an example. There's one that we're working with right now called On Point, and in fact they're going to be somewhere in Osun State today doing some optical check and also doing some surgeries for folks. We have to come together as a country, government, private side, and say there are pockets, to your point, where the local areas that we don't have the penetration, and we have to go out there. So part of what we are doing is we have a program called the Community Impact Program, where we are working directly with nonprofits to go into those local areas and provide help to them. Right? There's still, as you can imagine, a lot of opportunity in that space. Right? So we're taking the opportunity to invite other people to reach out to us as well, and let's partner. Let's give back. It's the right thing to do.
So in a state or in a situation where medical doctors are on strike, for instance, it means that telemedicine could be, an opportunity where, will telemedicine go on strike too?
No, telemedicine is not on strike. Telemedicine is not on strike. Hey, as you can imagine, I know that there's conversations between the medical association and the government, and we're definitely rooting and praying that they'll resolve this over the next couple of days, because quite frankly, who's suffering? The people, right? And that's just not right, and that's just not fair. So we're hoping that these things can be solved pretty quickly.
All right. Now, let's talk about briefly I'm looking at the time, but let's talk about the issue of abuse of drugs. A situation where you are not having a direct interface with the doctor, but you're doing that virtually, and then he tells you, this is a drug you need for this, and this is a drug you need for that, and then you have to walk into a pharmacy to get that, and then you have that at your kitty, and then after a little while, maybe after about a month or two, and you feel, I'm still feeling this thing again, and then because you don't want to interface with the doctor again, you go straight to the pharmacy. Is that a good thing?
It's certainly not, right? We do not advocate for self-medication. I think it's one of the biggest challenges we have as a country, as a people, because we feel that we're the doctor, we're the lawyer, we're everything, we're the banker, and we have to understand that there's a difference, and that's part of the education that needs to happen. Part of what we do on our platform is that we actually talk to a client every single month because of these types of things, to say, okay, we met you last month, we're sending somebody out to meet you this month. How did it go? Did you improve? Do we need to change anything? And we constantly drip that education to them and saying, look, we're here for you. I think when people gain the trust of the folks that are helping them, I think that they'll always go back to them. Part of the challenge is that today you go to the hospital, it takes you 3 hours to get there. You spend 3 hours to wait to speak to someone at the hospital. That's 6 hours, right? You went there with a stomach ache. You probably come back with a stomach ache and a headache, right? Of course you don't want to go back, right? You don't want to go back there, right? So, but when you have a seamless process where you can speak to someone that can help you, and what we've seen in our experience is that people are actually calling us, texting, calling, I have this, I have that, and they're really engaging with us, and it's been very helpful.
Now, from where we are coming from, a lot of people are used to the tradition of the manual way or the face-to-face engagement, where you go to a hospital, and then a doctor has to look at you and feel, feeling of the fact that this doctor is close to me, and he's smiling and he's saying you're okay. People are used to that kind of. But how are people easing up on that to accept telemedicine, where okay, you're just having an interface with the doctor, and he's not there to touch you and feel you and smile at you and all of that.
It's a process.
Right.
And I think to my point earlier, that's why we're doing a hybrid process right now, where we're bringing a nurse to come in, because we know that's an opportunity. There's a psyche to this thing, right? So we're trying to solve as well. But the second piece is that I think sometimes we underestimate the fact that Nigerians are very, very adaptable to change. Think about social media over the past 4 or 5 years. We now have 80 million Nigerians on some sort of a digital platform.
Yeah.
That tells me that people are really embracing.
That's more than some countries.
That's somewhat of some countries, to your point. I was reading a statistics earlier that says that a typical Nigerian will spend 10 times of their earnings on their digital platform as opposed to going to the
Very
hospital.
true.
Or as opposed to even buying food.
Yeah, very true.
So to your point, that's why we believe that that digital platform has become a central point of our lives. And that's where we need to really get people engaged, hence where you see telemedicine really coming through, and we're augmenting that with a hybrid approach with nurses.
Now, on that platform, do you pair a doctor to a patient where every time you call, there is a certain doctor you have to? I have my late grandfather would prefer to meet a certain doctor. He goes to the hospital. If that doctor is not on duty at the time, he prefers to wait even until the next day so I can see this doctor. And then the moment he hears the doctor is on duty, he begins to feel okay even before the doctor comes in. You know, that thing.
So that's the change. That's part of the change that we need to get people to understand.
Okay.
That seeing the same doctor all the time is not necessarily what gets you better.
All right. Okay.
Right.
Okay.
And that's the paradigm. That's the education that we need to help people understand. But you know, some people are saying, I do want to say that, and you know, we kind of work with them and help them through that, and
That's
get them the
being
doctor.
flexible,
Being
so there's
flexible with
something for
them,
everybody.
For everybody, as best as we can. But again, that's not what solves it. When it has to do with a specialist, maybe so. But when it's a general practice person, we believe that that's not necessarily needed.
Okay. Now let's talk about the economy of telemedicine generally. This is a platform that people are going to subscribe and pay little monies for and all of that. Now, when it comes to creating job, because it's like a medical chain now.
Yes.
How much of that is how many people are benefiting, and how can people benefit from that chain, where I am not necessarily a medical doctor or a nurse or a medical practitioner, but telemedicine is a science, you know, is a tech-related thing.
Yeah, no doubt. So to your point, when we started this journey, we were very, very particular about Nigeria, very passionate, obviously you can hear in my voice, very passionate about our country. So we built our whole organization in Nigeria. Our tech team is here, our operations team is here, all here in Nigeria. And to your point, that's employment. But let me also talk a little bit about the nurses. We know nurses are not making a lot of money today, right? Now, but we're bringing them in to kind of supplement, if you will, on their days off, where they can go spend an hour, 2 hours with someone and make extra income. That also helps with the economy. We know that we'll get to a space, because we're already having people saying, hey, can we have somebody go visit my mom and dad every single week? They're not a nurse, but I just want to make sure that they check on them. They do. Those are opportunities that we're also looking into. Think about them as patient care associates, like patient care associates that go in and check on them.
It's like building a community of people who are checking on
each other and making sure. Because, like I mentioned earlier, 60 years old as people dying at 60, it's just not acceptable. And we all have to play a role in bringing better healthcare to our folks, and it starts with education.
Amazing. Now, when it comes to upgrading and researching to ensure that we get better, what are you guys looking at when it comes to the future of what you guys do today? Okay, we're trying to expand and all of that, but we need to upgrade this. And what are you looking at when it comes to upgrading and ensuring that the service becomes better? Interesting
point. I think 3 things that stand on my mind. The first one is medical records. You, Mike, as a Nigerian, if you go into a hospital, we should be able to access your medical record.
Great.
Right, should be able to say, okay, Mike has this, and this, and he's been doing this and this and this. To the extent that the prognosis and the conversation we have with the doctor is evidence-based. It's data-driven, data-based. The second piece is, when you think about the future, we want to be able to use AI to be able to say, we've been seeing this over the past 2-3 years. We think these are some things that you should be concerned about. We're noticing that your blood sugar has been rising. We think that you need to start thinking about managing your sugar intake from an AI perspective. Then the third piece is, when you think about generationally, to say, hey, Mike, we serviced your dad and mom over the past 10 years. God bless their soul, whatnot. These are the things that we saw. These are the things you and your siblings need to be concerned about as you get older as well. Then you start to think progressively. That's when you start to shift the bar and really think about medicine in a different way.
Amazing. So when someone interfaces with doctors on the platform,
Yes.
and then after that conversation and, and all of that, and then something needs to be done, like a surgery and all of that, what happens from that point on?
So when we identify that there's a real issue, a bigger issue, whatnot, what we're doing is we are then referring them to a group of hospitals that we're engaged with to go further with surgeries and whatnot. And those hospitals have been very, very engaged with us. So there's still some more work to be done in identifying the right partner, the right hospital, the right specialty in very, very strategic locations.
Now, besides, are there so many other platforms beyond? Because the point there is, when it comes to telemedicine, it's just picking up gradually.
Yes.
Around this part of the world.
Yes.
Are there different platforms, or actually it's just the only one everyone has to?
There are different platforms out there. I don't know their names. I really don't care about their names.
You just care about what you do.
I just care about AxoCheck. But on the real, there are different platforms out there doing some similarities and some differences here and there. But everybody, as you can see, they're all in service to this great work that we're all trying to do. And I think that there's opportunity for all of us to start thinking about partnerships. In terms, because everybody's doing this, doing that.
That's where I was driving.
So how do we bring those things together? Because at the end of the day, the Nigerian is at the center of all of this, right? So it's about how do we take care of the Nigerian, and how do we help this great country? How do we help our people? And that's what, and with partnership with government, I think we can really move the dial.
So are you thinking in the long run about coming together to form a guild or a union, not to compete necessarily, but because of the kind of essential service you're offering, you can't be everywhere at the same time. It's possible you are in Lagos, and then there's another platform that services or that is used to in Ibadan, and then there's another service, like that in Enugu or in Kano, and all of that.
That's an interesting one, right? So there's some conversations that we are having with some other folks that, to your point, that might benefit all of us. I can say that AxoCheck is everywhere at this point. Obviously, we don't own the entire healthcare supply chain, and there's some partners that we need to kind of work with. But to your point, there is an opportunity for us to come together, even from a regulatory perspective, right? To start thinking about how do we make sure that we're doing the right things, we're having the right standards, we're delivering the right service to people at the right level, right? And we're all connected together for the betterment of all of us.
It's amazing. Thank you so much, Kazim Lawal, for coming on the program and talking to us about telemedicine. Thank you very much.
Pleasure's mine.
And we wish you well in what you do.
Thank you, sir.
Thank you.